Host if you want until I'm ready to share my screen.
Perfect. Let's do that. So you keep going.
Okay, perfect.
Thank you.
So I think I was just going to give you guys all my once over on what I consider a UTI versus interstitial cystitis or versus pelvic pain syndrome, which go together. So most people, when they think of urinary tract infection, they think burning, hurting, stinging. Okay. And when you say an actual infection, most people think that's because of bacteria. The truth of the matter is you can burn, hurt, sting for a million different reasons. Not literally, but you know what I mean. And you are the person that knows what your triggers or warnings are the best. So if you can keep a journal or use our app to document this, it's a much easier discussion with your physician if you come in and say, hey, 2 days before my period, I'm burning, hurting, stinging. It feels like a UTI. Because what happens is eventually what you can do is you can work with your physician. And if you know it's going to be 2 days before your period, make an appointment 2 days before your period, pee in a cup, and then see if you actually do have a true bacterial infection that needs antibiotics, or if maybe it's something hormone related. Same thing happens with bowel movements. Same thing can happen after sex. I have people who have symptoms of UTIs after horseback riding. A lot of my perimenopausal and menopausal women will have different triggers. Some people have food triggers. There's lots of different things, and you know you best. And when someone comes to me and says, here's my mystery, this is how many times I've been treated with antibiotics, it's very hard for me to backtrack. And I know a lot of people listening have probably had the experience of my doctor doesn't believe me, my doctor doesn't listen to me, just because I didn't have a bacteria found in my culture, they won't treat me. Most of us, speaking for physicians, hate chronic UTI and interstitial cystitis as a puzzle because we went into this to help you. We went into this to figure out how can we make you better? How can we fix this? And the deal is it's not always a one visit and done. It's a let's find a pattern, let's work together. And we want to make sure that we're helping you in the best way possible. Okay. So, for instance, in bacterial infections, true bacterial infections, you need antibiotics. The problem is that a lot of people have symptoms of a UTI, burning, stinging, without true bacteria. And the problem is if you're calling in and not checking with the culture, then you might be getting antibiotics when you don't need it. Supplements, okay, like 36 milligram packs for Utiva, or also things like D-mannose. There are some other products that can help keep away some infections sometimes. It doesn't work for everybody, but there are a lot of people it works for, and it's good. There are also PhDs and people all around that are working on better tests and vaccines. And some people believe that all pelvic pain is due to organisms that we just haven't been able to figure out yet. As someone who practiced medicine, I also see all the time that there are many people who are colonized, meaning their bladder has bacteria in it all the time, and they don't have symptoms. So those patients don't treat them, right? Obviously, if you have fevers, there's exceptions, but there are reasons to treat versus not treat. So I basically sat down and said, how can I put this all into one quick, easy reference using guidelines that I use? I use the American Urologic Association, the AUA guidelines. The thing that is different between our guidelines and say the ACOG or the gynecology guidelines is it varies for use of antibiotics and timing of antibiotics. So there are different guidelines, which, as you can imagine from a physician standpoint, is tough because not all doctors do the same thing. So one patient may get antibiotics before and after sex, and one might get them only when they have a true culture positive. So these are all things to keep in mind. The other thing about UTI symptoms is hormones play a big part. So talking about birth control, menopause, things like that matter. It all matters. Okay. And then finally, pelvic floor physical therapy, making sure that your muscles are tight, things are not prolapsed. There's a million reasons to see a physician and have open discussions. And it's very confusing. And even some of my best girlfriends who are GYNs will send people to me because they said, she's like, I don't know, I'm missing something. This lady still has pain, help. And sometimes I have to send people down to my friend Rachel in DC, Dr. Rubin, and say, I don't know, she's sex medicine trained. So there are a lot of different ways to go about looking at this. So I want to talk to you sort of about how the app can help you figure all this out, because I could talk forever about the clinical side of what makes a bacterial infection versus riding a horse, which gives you urethral irritation potentially, versus your pelvic floor falling out. All those things can give you the same clinical symptoms, burning, stinging, pain, but it's not necessarily one cause. So if you could make me the host for us, I can start showing people some screenshots about how and why tracking symptoms matters. All right.
So do you
Let's
want
see
me
if
to
I
make
can
you
do
host,
this.
Dana?
Yep, I think it says disabled screen sharing. Awesome.
Here, please try.
All right. Here we go. See if you guys can all see what I see. Does everybody see a bladder, hopefully?
Yes.
Okay, perfect. So basically, when I designed and made UTI Tracker, what I wanted to do is I wanted to make it similar to like a period tracker, right? A lot of women nowadays will track their health symptoms. And one thing that really helps me is figuring out if patients know when they have a good or bad day. So does it hurt? Does it burn? Does it sting? Or nope, I'm super happy. I don't have any problems. If you download the app and you look at it within the symptoms category, there are lots of other things, fevers, chills. The reason I did this, and you'll see a little bit later, is that I gave some pop-up warnings like, hey, if you have blood in your urine, this is something that you probably shouldn't manage yourself. You should go talk to a doctor about. So in addition to just logging things, it also gives you some tips and tricks. The biggest components you can see over there on the side are, hey, keep track of what your symptoms are. Because if on Thursday it burns, but on Saturday you're peeing every 30 seconds, right? That matters. It helps a doctor figure out what to look at. For females, more than males, but for females, sex matters, right? Is there vaginal dryness? Is there atrophy? You know, what's going on? Bowel movements, believe it or not, people probably know diarrhea can lead to UTIs, right? If you're messy or if you have incontinence or things like that, fecal incontinence on top of urinary incontinence. There's a lot of different types of things that can bring you a UTI. But constipation, you know, are you a dysfunctional voider? Do you not poop well? You know what? If you don't poop well, you probably don't empty your bladder well. You're probably someone who might be more prone to UTIs. In women, periods matter. And then after periods, it's a whole big important topic of menopause. Supplements, do you take them? Do you know when to take them? How often do you take them? And then water intake. Are you drinking? Are you dehydrating yourself? Are you drinking enough caffeine to make it climb a ceiling and make your bladder get all aggravated? There are a lot of different things that you can do. And if you write it down, you're going to do better. Nobody remembers 2 months ago they had Chinese food and had diarrhea, and then 3 days later they had a UTI. And then 6 months down the road, it happens again. But if it's in your diary, you'll be able to put a pattern together. If you are someone who has chronic UTIs, or my college girls, please pay attention, you can get even more in depth. Besides just good day, bad day, you can start tracking things like, do you have an infection? Were you treated with antibiotics? And one of the things that I particularly as a physician like to know is, what was your culture? How many colony counts? What antibiotics do you have? The reason why I say college kids pay attention here is because for me, if you're in college, you probably get treated at your student health. You've probably gone to your primary care. You've probably gone to your your GYN. You've probably gone to patient first, 9 million different places. And everybody said, oh yeah, you have a UTI. Here's your antibiotics. Follow up when you get to your home physician. And then you guys come to me and said, I have 6 infections this year. And I say, oh, give me something, help me out. So the app will let you keep that all in one place. This is also really good for pediatric patients who see their pediatrician sometimes and their urologist other times. But there's lots of different reasons that this is something to pay attention to. So the app can really be useful for specific information, not just overview stuff. Sorry, I'm trying to get to the next screen and it's not loving me. All right. The app in general is going to let you email your symptoms of your journal, or also if you're using it for overactive bladder. Did you pee today? Did you run? You can print that out yourself and bring it to your doctor in a nice organized way, which I'll talk about on the next screen. Okay. And then what the app also does is it gives you lots of different options for learning about information and also reminders. And I'll talk about the reminders in 2 seconds. This is your overview screen, okay? The screen on the left where it has your calendar, you can print or email that to yourself and print it. And you can see I tried to use a little code, right? So if your boyfriend or your husband or somebody looks at that, they don't necessarily know the code without reading all the little symbols. But you can have a good day or a bad day, which shows in green or red. And it also shows when you have your period versus when you're on antibiotics. And it gives you a nice little overview. The reason why I have this kind of calendar, although it's nice for patients as well, the reason why I do this is because as a physician, looking at this calendar is a lot easier for me to get a 2-minute overview with a very good idea of your symptoms versus a patient giving me a list with 900 things. Like I get a good idea if someone comes in and they always have a UTI around their periods just by glancing at this. And then you can see on the right screen, it also gives you the more detailed information. What antibiotics? You can see down here, did you have leukesterases? Did you have nitrates? All things that some people really emphasize. And from a urologist standpoint, that's nice information to know if I can have it. One of the things I really like to know about my patients is how often do you pee and how much do you drink? And the reason why is because some people will come in and tell me, I have a UTI, I peed every 15 minutes. Well, maybe you did, maybe you didn't, right? You probably peed a lot. I agree, your symptoms are probably terrible, but was it really every 15 minutes? So this helps. This is also a very nice screen for overactive bladder patients, if there's anybody out there listening with that problem. The other thing the app does is it has an interactive feature. It will let you set a reminder to do your journal, take your supplements, as well as you can set your clock to remind you to pee. So for anyone who's a dysfunctional voider and goes every, 10 hours, holds your bladder all day, if my nurses are listening, y'all know who you are because my nurses are the worst at holding their bladders. But what it'll do is my little happy face bladder will pop up on your iWatch or your phone or whatever smart device you might have. And it doesn't, alarm pee, 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 but if you get a little text that shows a bladder, you're much more apt to urinate on time. And, if it's 7 o'clock and you're laying down or, having dinner or whatever, oh, hey, I can take my supplements now. It's time to take my Utiva. It's time to make sure that I put my journal in for the day so I know what my symptoms were and my doctor can help me figure this out. All right, this is the doctor in me, the notifications. I designed this so that if someone was putting in a trend of I had fever, I have blood, I have things that can say, hey, this is a warning. Don't pass go, don't collect $200. You need to talk to a doctor. Because a lot of times people will wait things out at home that they probably should not. So hopefully that helps. The other thing it does is it gives you weekly advice and weekly tips. So there's a lot of over-the-counter things, a lot of behavioral things that you can do. And sometimes they're as easy as, peeing more often. And maybe people don't think about that, but it is important. So on top of all the active features in the app, there's also tips. And then finally, the education center is where you get guideline-based information. You get over-the-counter products that are available. And then Utiva has their products and why they work and how they work on there too, since they're helping me spread the word and get the app out and using it for their customer base, which has been great because it allows me to reach more people while I do my day job, which is operating, 2 or 3 days a week and 40 patients a day. So it is nice to have someone who is helping me get this out because the bottom line is This is a topic that not very many people talk about. Tons of people are invested, men and women, in chronic UTIs, pelvic pain, interstitial cystitis. It's a demographic of patients that are very underserved. And if physicians and patients can find easy ways to work together, I think we can help find better answers and better treatment plans. And I use it with my patients, my friends, and even for my child who also happens to have UTI. So I think that's pretty much my spiel. I'm happy to give tons more information, and I'm going to try to make Faraz the host again, so I can pay attention to the chat a little bit because I see things popping up over there, and I
Yeah.
don't want to ignore everybody.
No, thank you, Dr. Rice. I think we're both hosts now.
Okay.
So we figured that out in the background. No, that's great. That was a great overview of UTI versus ICs and how we can manage symptoms. I have a question for you on the recording of information. First of all, when it comes to knowing what bacteria you have that
Mhm.
you can actually record into the level of detail, such as which bacteria, what is the colony count, how could you empower us to get that information? Like, I know every healthcare system is different, every process is different, but what is our role to get that information when we get these tests out, and how do we fill that in?
Yeah. So for me, what here in the United States, one thing that a lot of health systems are doing are putting online. My institution uses my chart, but there are a lot of different things. You can sign up for websites afterwards to get your lab results. And in the app itself, if you hover over where it says urine culture, they give you sort of a sample urine culture, and it'll show you this is what you're looking for. This is where you're looking for colony counts. This is where you're looking for names, and you can enter the information there. Generally, most labs use almost the same template all the time for reporting their urine cultures. But urine cultures are really important to establish patterns, right? If you're someone who has E. coli all the time, that's one thing. Proteus is a different type of infection that makes me think about kidney stones. So even though there are people out there that say urine cultures are not accurate, okay, and some of that may turn out to be true. We may need more detailed studies and things like that for urine cultures, but I got to work with what I'm given. And if I have someone who's gone somewhere and had 6 urine cultures but never has results, I can't get them as much information. Whereas if a college kid who went to their health, their university health system called back to that place 2 days later and said, "Hey, can you tell me the bacteria type?"
Hmm.
or called urgent care and said, "Hey, my doctor wants to know the bacteria type," they can put that in the app. And then when you see your physician can hopefully garner more information.
Perfect. Perfect. I'm noticing questions coming in, and I highly encourage everyone to put their questions in the chat box so we can prioritize. We do have a good 30 minutes ahead of us, so we will get a lot of opportunity to get through these questions.
Whereas
Um,
I'm happy to talk to if people want more specifics. I just didn't want to throw a ton of information at everyone at once because my big thing for anyone watching is it's important for your physician to talk to you like you're a normal person. Throwing around big terms and everything that's not going to help you in the long run is not going to be worth it. And I do have a few other quick things that I can just answer a couple questions ahead of time if you want me to do that and see if that helps with some of the questions.
I have one here, and then why don't
Yeah.
we turn to your question there?
Yeah.
And it kind of relates back to what we were discussing. And this is a question I think from Shoshana is, how do you know when to treat? So how do you understand your symptoms so you know when to treat a UTI or not? Because people often worry that it may lead to kidney infection or some more severity. And it has a follow-up question that says, how long do you have to do pelvic physio to see results for a change? So I think there's a two-part question in there.
Two-part question, no problem. So the truthful answer to that is this is where the app or journaling comes in super handy, because the fact of the matter is there are people who need to be treated right away for a UTI. So HIV, immunocompromised, sometimes diabetics. There are certain patients, infected kidney stones, that need to be treated no matter what, all the time. See your doctor, don't pass go. There are people who get bladder infections, right? That people still call UTIs, but I'm going to call them specifically bladder infections. Some people can wait a little bit on their bladder infection, up their supplements, drink more water, see how they do. They may not need antibiotics instantaneously. As you know your body, you need to talk about this with your physician. A lot of my patients at first, they say, "Oh, Dr. Rice, don't make me wait it out. It feels miserable." I say, "I know it feels miserable. Pop some Perium, Azo, pain medicine. Let's see if in 24 hours your symptoms go away. Let's see if we can break your cycle of UTIs." So when you need to be treated is a little bit of a dicey question. You always need to be treated or see a doctor immediately if you have fever. You really need to follow up with the doctor if you have blood in your urine, and then if you have any underlying medical conditions. But once you establish a treatment plan with your physician, there's shades of gray everywhere. Again, art of medicine. Pelvic physio, that was the second part to that. What I would say about pelvic physical therapy is it depends on your problem. If it's a cough, laugh, sneeze type, I pee my pants, you may need months, right? I'm not going to get a washboard stomach if I do 30 sit-ups today. I wish, right? 2 babies, not so much. I have to hit the pavement and run to do anything. But if you have pain with intercourse because you have vaginal atrophy, you may only need a few sessions and some information about lubrication, or you may need vaginal dilation and a long path. So working with a multidisciplinary approach, which is your doctors, your physio, your primary care, that is the best way. There's no one hat fits all, which is why from a doctor's standpoint that I wanted to put all the information into one spot, because I've had girls come in to me saying, I read on the internet I drank a box of baking soda to make my UTI go away. And I thought, oh my God, I got to check your electrolytes and make sure your kidneys aren't in failure. Like, you can't drink pure salt, right? So this is something to help journal, find your patterns. When you know your patterns, have a sit down, real discussion with your doc. And a 20-year-old may be able to go a day or two longer than a 7-year-old on a UTI.
Sounds good. Dana, just to follow up on that, and as you're talking about tracking and managing patterns, to the topic of our discussion today, which is UTIs versus IC, a question that had come up, it was submitted by some of the participants, and then it's a very common question is, how can I tell if I'm having a UTI or an IC flare-up?
Yeah. So again, patterning and tracking is going to be key here. And interstitial cystitis or pelvic bladder pain syndrome is something that should be a diagnosis of exclusion, right? You need to work with a physician. You need to have workups. I do cystoscopies on my interstitial cystitis patients to look in their bladder, make sure there's not a bladder tumor, something anatomical going on. So once you know that you've kind of ruled out everything bad from a physician standpoint, then I sit down and I really kind of hammer home what's a flare, what's not. But it's not a one-time answer. I tell my patients who come to me and say, I have a diagnosis of IC, I generally say, do you have a diagnosis of IC or did you have an old gray-haired physician? Because unfortunately, even when I was a kid, right, people used to say, oh, it must be sex related. I'm like, I'm 18. It's not like, this isn't what's going on. I don't know what it is. So you have to have someone that you can talk to openly and who's going to listen to you. For me, what I try to do is I really try to know my patients. I try to establish their patterns. I have them come in and get urine cultures. So at least I can rule out the common bacterias. If you read some literature, there's some good data coming out about different projects and there's different companies that have more detailed urine cultures, and there's a time and a place for that. But you also need to know your hormones and what does your vagina look like if you're a female? What does your prostate look like if you're a male? There's more to it than just this is a flare because my urine culture was negative, and you need to know your triggers.
Perfect. It's coming back to just managing it on a daily basis, tracking your triggers and the patterns, which allow for a holistic approach to UTI management. It's not one thing, right?
No.
So
It's never one thing. And the problem is that women have had UTIs for a million years, right? And at first there was only men in medicine. So things get ignored, right? What I usually tell my patients is, do you think if men coughed, laughed, sneezed, and wet their pants after they had children, that that problem wouldn't have been fixed decades ago? Of course it would have been, right? So we were behind the eight ball. And now that there are so many more women in medicine, we're trying to figure this out. There are people everywhere trying to make this better because it's a real thing. You might have urethritis, which is irritation of your urethra and inflammation that makes you want to tear your hair out. It feels exactly like a bacterial UTI. But sometimes it takes 3, 4, 5 cultures with my patients. And I say, listen, I promise there's no bacteria I can find. And I was like, but you're menopausal. This might be a hormone issue. You might need some testosterone, not just vaginal estrogen, which is a lot of the go-to here in the States, right? Sometimes you need testosterone. There's the rush of the vulvodynia. I mean, there's a million different little specific things. And as we get more women who are specializing in sex medicine and the different groups and societies for sexual medicine, we're learning more about how a lot of these people were put into the bag of, you have IC, right? No, they didn't have IC. Their bladders weren't the problem. Their urethra and hormones were the problem. So we've got to listen to patients, and patients also have to put faith in doctors sometimes, because it can be very frustrating for a patient to hear from a doctor, it's not a UTI. I don't know what it is. Let's work together and figure it out.
That's good feedback. I have a number of questions coming in all around the various options for UTI prevention,
Yeah.
or even treatment. So I'm going to try and bring them all together. There's a few different ones in there, but I'll start one with D-mannose. And the question here comes in is, number one, is it safe to take maintenance dose of D-mannose 1 gram a day? And do you know of patients who experience stomach discomfort using D-mannose for 7 months?
Sure. Let me give you sort of my canned speech that I give my patients. I think I'll probably cover a whole bunch of it all at once. So first and foremost, there are lots of ways to manage UTI that are just behavioral changes. So if you're a camel and you hold your bladder for your whole shift when you're a nurse, which I tease my nurses all the time because they know they do it. Listen, doctors aren't any better, but my nurses sometimes won't drink and dehydrate themselves over their 12-hour shift. Think of your bladder like a pond, right? If your pond is always stagnant and hanging out there, you're going to get slime on the top. Whereas your ocean, if you're drinking more, peeing more, you have less chance of having crud build up in there. So peeing regularly, drinking fluids, right? And everyone asks me how much. Well, I don't know. Everybody's different. I tell patients to start with, sit down and pee at lunchtime. If it looks yellow, it's probably not enough for the morning. Drink more the next morning. Don't try to catch up all afternoon or you're going to drive yourself crazy, right? Because you're going to pee all night and then you're going to hate me. So water matters, okay? Behaviors matter. There are so many myths that every woman was told, right? Don't take a bath, don't wear a thong, don't wear nylons. I don't know, that doesn't make sense, right? If you take a bath and you use some bath bomb that makes your legs break out and you have hives, yeah, that's not helping your UTI situation, right? But if you use a baby wash or a Vino or whatever, something that's gentle on your skin, if it doesn't irritate your skin, it's probably not irritating your hoo-ha. If you are a swimmer, right? Yeah, if you sit in a wet bathing suit for 10 hours, you're going to have crotch rot, you're going to have yeast, you're going to have other problems. But if you're a person who goes to the beach, swims, dries off, change your bathing suit, it's probably not your cause. Not everyone falls into these categories, but a lot of people do. I hear a lot about, did my incontinence pad give me a UTI? Well, does your incontinence pad bother the rest of your skin? So are you irritated in general down there? Or when you look with a mirror, does everything look normal? It just burns when you pee. Because contact, right? Contact with your pad can irritate you. It can give you symptoms of UTI. And that's harder to manage. Some of us have tricks about wearing cotton underwear under your pads. So you get a sandwich of underwear and pads if you have a contact dermatitis or skin irritation. But generally, if you're changing your pads regularly and it's not irritating the rest of your skin, it might not be the cause of your UTI. Thongs. If you wear the same thong 5 days in a row, yeah, that's not going to help your situation. But I don't know anyone that does that, right? Lots of times women are given all this, it's hygiene, it's this, it's that, and it makes them feel crazy or dirty or like they did something wrong. And that's not the way to look at it, right? The way to look at it is if you have good hygiene, if you're drinking fluids, if you're taking some supplements, if you're doing the things that you can help yourself do in normal behaviors, that's probably not the cause of your UTIs. You need to talk to a physician. As far as the supplements and the question that you asked about the D-mannose goes, is that I think personally that the data on a lot of these studies are very hard to get, because it's very hard to take a group of people with urinary tract infections and put A into the 36 milligram packs category, right? Put B group into D-mannose, give C group no treatment, give D group antibiotics, right? That would be a nice randomized controlled study, except they all need to be the same age. They all need to have the same period cycles. They all need to be sexually active or not sexually active. And then you all need to have the same bacteria, right? So there's no really great controlled studies to get all of that at once. There are some very good studies that say 36 milligram packs products do help, and they help all comers. So not just E. coli UTIs. So that's great. In my art of medicine practice, I find that my patients who have E. coli tend to do really well with D-mannose. D-mannose in general, some people do have stomach upset. That can be very dose dependent. I also have seen people where, I don't know if I believe it 100% or not, but I have seen people with diabetes feel as though the D-mannose also gives them sugar problems. So I'm very careful with that too. I have to pay attention to that. But if you don't have diabetes, you don't have complicated things, I don't think these products are going to hurt you. So if it helps, fantastic. That's how I look at supplements.
Sounds good. On and I have a number of questions on various products, the 36 pack product, probiotics, but one which I'll switch to is methenamine.
Yep.
And the question is, can you comment on the use of methenamine as a prophylactic for UTIs?
Yeah, methanamine is something that I have to defer to patients to talk to their physicians about. So methanamine does work great as a preventative. So it's not exactly like this, but basically what happens is it's a liver breakdown product that puts a little bit of formaldehyde into your bladder so that bacteria can't glom on there. Remember I said your bladder can be a pond or an ocean? If you've got a little bit of methanamine in there, even if you get a little swamp-like, hopefully it will take care of it and not let that bacteria grow into the bladder wall. That's the idea with methanamine. I do like methanamine for some patients sometimes, but you do have to be careful about liver function, stuff like that, things you take it with, other pills you're on. So with anything that I would say in sort of a generalized forum like this, really check with your doctor and see, if it's good for you or if this is something that you could have complications from before you put yourself on it nonstop.
So can you give us some more clarity then? Because a lot of questions here are on prevention of,
Yep.
of urinary tract infections. So, I mean, as Utiva, we have 36 milligrams of proanthocyanidins. There's a role of probiotics and D-mannose as an option as well. So can you bring it home for us on what should everybody take for prevention of a chronic UTI?
Yeah. So first and foremost, what I'm going to tell you to do is work on yourself. Figure out your triggers, track your symptoms, make sure you're peeing regularly, make sure you're drinking water regularly, make sure you know if your hormones are in check or if you need estrogen or testosterone or all that. Rule out all the anatomic stuff. If you are a regular old UTI after sex, when I'm stressed out, when I get run down kind of person, then I think that 36 milligrams packs is the one to, really take first, right? If you don't know why, you don't know your urine cultures, you don't know everything about it, 36 milligrams is always going to help you. And there's very few side effects from that that I see, right? You can take that pretty much no matter what with every medical condition. So that's perfect, not going to hurt you. As far as D-mannose goes, I like D-mannose in my sex people. If you get it always after sex, you're probably going to be an E. coli kind of person. D-mannose is very good at keeping away E. coli, in my opinion. The other thing D-mannose, I feel as though it does, is it sort of makes it so that the E. coli that you may still see in the bladder is not as painful. So you may be somebody who's colonized, but if it doesn't hurt you, what do you care if you have, bacteria in there if you don't have other medical problems? So I do like 36 milligrams packs and D-mannose kind of right away for my patients as this is not going to hurt you until I can figure out what's going on with your bladder by looking in there with a scope or finishing my anatomical workup and figuring out your vagina, because your vagina, if you're a woman, plays a key role in 90% of this.
And what about probiotics and the role and impact they have? And how long do people take that?
Yeah, so probiotics depends on the person for me. I like probiotics whenever anybody's on any kind of antibiotics, right? So it works as a gut stabilizer in theory. The data on probiotics is also, not as definitive as I would like it to be, but I don't think it hurts anyone. So what I usually tell my patients is if you are a constipated and or diarrhea or IBS person, the probiotics can really help get your bowels in check. And also if you are a yeast or BV or a vaginal person or symptoms, then it also helps with the vaginal flora. And for what I tell all my women is little bitty area, right? Clitoris, urethra, vagina, rectum, small area. All those organs go up together. If you can keep the health of all of those organs, your bowels, your vagina, your urethra, your clitoris, right? All of those things in check, you're going to have a much healthier, happier pelvic floor.
That's awesome. Now, one follow-up on probiotics, vaginal versus oral. And we've had that confusion come up a lot. And is there any science to back it up? What do you typically recommend?
Yeah. So I recommend whatever you're comfortable with. So the deal is that the oral and vaginal probiotics matter for different things, right? So I think there's pretty good data, although I'm not 100% familiar with the source, so I can't quote it, but I'm pretty sure there's very good data in the GYN literature that shows that sometimes vaginal probiotics can be more helpful if you are a chronic yeast infection / other type of infections. The thing about vaginal probiotics is A, they're messy, B, they're kind of hard to take for some people, and C, if you already have vaginal atrophy as a problem, then you may not want anything up in your hoo-ha. So you may be better with oral. I usually start my patients on oral everything just because taking a pill at night when you brush your teeth is a lot easier than putting something in your vagina.
Sounds good. Okay, that's good. Good. There are a number of questions here, and before we move away from products, the question has come up is, what are 36 milligrams of packs? And there's so many cranberry products out there, so how do I differentiate?
Yep.
So
the data was shown sort of on a generic 36 milligrams proanthocyanins, right, which is the active ingredients. I say packs because if I said the name out all the time, I would go crazy, right? So it's packs like Pac-Man, PAC is what it stands for. And basically the reason why this was picked is because this is how you make the product, or this is what it was made and tested with. So this was the dose that they did all the studies with. And if you look at the AUA guidelines, this is the one thing that is really supported as a supplement because they have true data behind it. As far as products go, which one's better than others? So Utivia is going to kill me on this one, but what I tell my patients is whatever you're going to take is really what you need to do, but you want a 36 milligrams packs. And the thing for me that's nice and why I partnered with this company in particular is because they care about the patients, right? So just talking with Faraz and Derek, they want their patients to have the highest quality stuff. So they're doing the research, they're doing the quality control to make sure when you take their tablets, you're getting that actual amount. For me, I tell patients, yeah, you can look online and you can look on Amazon and you can see a 36 milligrams packs, but what if that's not made here in America or Canada? Or, what if that's somewhere where it's not quality controlled? What if that is really only 10 milligrams PICS? That's not what my data showed. So I've been happy to work with this company because they're putting out products that have, Utivia has good products for something that I would already recommend. So if you are my patient, you're going to get the actual medical terminology. You're going to get a 36 milligrams packs and you're going to get a list of different products. So as a doctor, this app is my passion. This app was something that I designed to try to help physicians and patients get better care. And it just happens that Utivia is a great product that's been nice to me and helped me out. And I think they're going to be able to use this app in a greater way than I can, because as Faraz said in the beginning, I like doing cancer surgeries. I am a surgeon at heart, and I don't have time to podcast all the time. I don't have time to do a lot of different stuff. And I really am passionate about getting this information out to the public. So I hope that answers what you're looking for.
No, thanks, Dana. There's a couple other questions here. We have about just under 10 minutes here. Vagisil came up as a product. What's your opinion on using products such as Vagisil wash in the shower?
So I am a personal hater of anything that is not natural in your hoo-ha generally. So for me, what I tell my patients is, if you have hair or things that can get trapped and dirty, right? And I say that because everyone laughs. I know in the beginning you mentioned I did a podcast with Ashley Iaconetti from The Bachelor. I work with her dad and he introduced me to her. And she's lovely. But I did a really kind of down and dirty sex UTI podcast with her about the app. And what I basically say is, if you still have hair, right? Because a lot of people wax nowadays. But if you still have hair, wash the hair with soap and use a gentle soap, a babyish type soap, or simple, no fragrance, no anything. You really shouldn't need soap to go on the inside folds. So if it's red, moist, mucus type stuff, flushing with water in theory should be enough, right? If you have a yeast infection or a GYN problem, I would talk to your GYN about how exactly to use that. But I tell people, don't use baby wipes even. Just, pat yourself dry, make sure you're not moist. Don't buy the heat up glitter, sparkle, lubrication type stuff, because anything that has more chemicals down there can mess up your normal flora. And once you start messing up with your normal flora, you're going against your probiotics and your supplements and all that kind of stuff.
Okay. The other question was around, what is the relationship between your period and UTIs?
Yeah. So there's a lot of different elements to your period that play a role. Number one is hormones in general, right? Can mess up vaginal flora, can make different biomes or bacterial growth patterns different. But also hormones can make you feel like you have a UTI even when you don't. And we see this a lot when people are going through menopause, because sometimes it's vaginal dryness and sex related. But sometimes birth control pills can also do this. So when the question is what are your periods and your UTIs? My question would be, if it's always around your period, is it a true bacterial infection, or is it symptoms of a UTI? And then once we kind of figure out is it true bacterial infection, my next sort of thought would be, how often do you change your tampons? Their basic hygiene, which most women do perfectly fine, but I still ask the questions. And then if it's, perimenopausal, starting to skip period timeframes, that's when I get into the, you need a little testosterone, you need a little boost. What do you need?
Okay. I'm going to shift the questions to the app now. There's a couple in here. Before we do that, one thing I should have corrected before Dr. Rice says our name is Utiva, and I know you say Utivia, but just for all the listeners, especially the ones that have been coming on for the first time, if you are Googling the name, it's UTIVA, and no worries, Dr. Rice will.
I was gonna say, did I say it wrong today too? I thought I said it right today.
We were joking about that the other day.
I'm the worst with names. I'm sorry.
No, thank you. No, it's been great. Great Q&A so far. One question that's come up here is, where's the data from the app being stored?
Sure. So I would, info at UTI Tracker is the email that gets us to the people who are way smarter than me. And they can give you all the very specifics. But the generalized answer that I have to this, because this is how I understand it in my head, is that when you enter your information and all your personal information into the app, it immediately goes to cloud server, techie, geek, whatever the heck that storage unit is. And it gets converted to some god awfully long number / code, right? So everybody gets assigned their, I don't remember anymore, say it's an 11-digit code, right? So you get assigned to your code, and then your code goes to the next server through a firewall. And that's where information gets stored. So there's a 2-level, I believe, secure something, and it gets encrypted. So people should not be able to get your personal information. The personal information gets stored under a blah number. So you'd have to hack 2 systems to be able to find people's identification, is my understanding.
Perfect. No, it's great to hear. We do have, for those that are listening in and have an interest in the app, and hopefully you realize the importance of it, and you would be open to downloading it and start using it. If you have any questions, we do have the developer of the UTI Tracker app amongst us today, so we can stay beyond 2 p.m. once Dr. Rice can sign off, and Eric can stay behind and answer any questions if you have. In the meantime, if you want to drop in a question in the chat box, we can do that. We're almost at the end here. There's a couple of questions that came in that I can start commenting from. And the question is, when is Utiva launching a D-Manos product? And we're quite excited. I mean, we really accelerated the launch of a D-Manos product actually after we started speaking to Dr. Rice and learning a lot more. And as we consult with others in the urology community, it has a role, as we all understand today, for E. coli related infections. So we will be launching a D-Manos product next month. So that really does expand our portfolio from having a 36 milligrams of pack controlled supplement for your daily prevention. But when you do have the E. coli, when you have more sex or trigger associated UTIs, you've got the D-Manos option, oral probiotic, and we're looking at natural wipes. So nothing scented, no nothing, like very simple natural wipes. So we keep expanding on our line, and we haven't forgotten the pediatric community with gummies. So we're quite excited to launch 18 milligram gummies for kids, but I mean, any age can use the gummies. So this really broadens our entire portfolio. Like, we started with one product backed by guidelines as 36 milligrams of packs, but now in 1 year later, there's a whole portfolio to serve the needs of various options for UTIs. I have nothing else to add in terms of products or announcements. I know we're just at 1:59. Is there any last question anyone has, and we can wrap it up, and you can let me know if you have any questions on the app itself, and we can stay back. I will unmute everybody if you have any last comments and talks, and then we can sign off. I don't know how to unmute everybody.
Well, I'll say thank you for everybody joining in. I know this is an important topic, and I hope that everyone is having, good healthcare providers and good relationships, because I know that can be very difficult. And thank you very much for doing all you do for us, because there is a great need for all of these products.
There's a big team behind here, and all we focus on is UTIs. So we're happy to have you, Dr. Rice. Thanks so much for your time. And a question that's coming in is, where do you get the app? You can go to utitracker.com, and you should be able to download it on your Google Play Store or the Apple Store, or you can go straight to the stores and download it straight from there. It's a free app, and we'll continue to offer more Zoom sessions in the future, in the new year. Thanks, everyone. We'll sign off if there's no other questions on the app.
Thanks, Dr. Dana.
Thank you. Thanks, everybody.
Thank you.
Thank
you
you.
for the information. Thank you.
Thanks,
Yes,
everyone.
thank you. Take care. I'm here.
Appreciate it.
Take care.
Thank you.
Nice to see everybody.
Thanks, Dr. Rice.
Thank
Great
you.
talk.
Was great.
That worked well, Dr. Rice. No technical issues. That's what I'm always worried about.